All right, let's get into it here. This is going to be a short video. We're going to talk about the root cause of anxiety. I want to talk about many people in America are dealing with anxiety. We're talking about just extrusive thoughts, overthinking, anxiousness, jittery, whatever it is, heightened heart rate, dysomnia type symptoms, tachycardia symptoms, arrhythmia type symptoms. So I want to talk about the modern way of symptom management for anxiety can be very effective and useful and helpful for many Americans and many people across the globe, that is. And that could be medications, therapies. I think therapy is great, and any other modalities such as that. But I do want to talk about many modalities that may go under the surface in conventional allopathic Western medicine, even in functional naturopathic or naturopath medicine, if that is. And I want to talk about what is it? What are some things that can cause the anxiety? What are things that can make you overthink, extrusive thoughts? I'm passionate about this, very much so. And when you see the content I post and everything I do post, it's multifaceted. Because healing is multifaceted. You can't just have someone who focuses only on gut, only on the endocrine system, only on neurological health and its effects. You want to focus on everything in totality. That's why I bring in the experts. That's why I hire on experts in my whole program, in my company. That's why I do all that for you. So I want to talk about one pronoun effect. So if you feel that you're dealing with a ton of anxiety, we're talking about extrusive thoughts, just overthinking, not being able to stay still, even ADHD type symptoms, OCD type behaviors. Check your thyroid. Not just a TSH. Check your thyroid. We're talking about all thyroid markers. Everything that has to deal with right here and even right here. So what does that even mean? So when you are dealing with, let's say, an overactive thyroid, which is more, I would say, more uncommon than under thyroid, but it's still prevalent because actually 90% of hypothyroidism, which is actually indicated as an underactive thyroid, is actually Hashimoto's. And when you deal with Hashimoto's, you deal with a fluctuation between issues such as having too much thyroid hormone and then too little of thyroid hormone. I just realized I'm talking a little too fast here, but I do want to also speak on. So when you check this full thyroid panel, you don't just want to check TSH. You're going to want to check T3, T4, and then the most important two is TPO and TJB. Now, there's other markers like TBG, and I know this sounds like foreign gibberish to you right now, but understand that when you check these markers, when you look at these markers, like the antibodies, that is the TPO, and the TJB, you're going to identify, am I dealing with an autoimmune attack? Because you could be dealing with either Hashimoto's or even Graves' disease. Those are two serious forms of thyroid conditions, thyroid autoimmune conditions. Now, I want to talk about what does this mean for you. So what's going to happen is that your body's going to fluctuate between hyperthyroidism and then hypothyroidism, for the example of Hashimoto's. Now, if you do not know what these conditions are, I'm totally with you. I totally understand where you're coming from with that. Just understand that these are autoimmune conditions that most likely your doctor has never tested. Now, does that mean you actually are dealing with that and that's the cause of your anxiety? No, absolutely. Just like every biology and genetic is different in terms of you and what you're dealing with, there's many other forms to that. Okay, so where are we going through with that? Okay, so we know that other forms of anxiety can come from this thyroid, but what are other ways that anxiety can come from? Glucose, dysregulation. We're talking about A1C, we're talking about fasted glucose, postprandial glucose through the roof. We're talking about through the roof here. So what are we seeing here? So I think 50% of the population is pre-diabetic. I think 50%. We're talking about an A1C sitting between, 5.7 to anywhere from 7 and beyond, anywhere between that. And that's a serious issue, a very, very serious issue. I mean, even 5.8, 5.9, that's still pretty not good. So when you have this heightened sense of glucose in your body cells, in your body just systemically lingering, you could say, it's going to lead to many issues downstream, physiological problems. Obviously, the blood sugar crashes. You're going to lead to anything such as, a big one I see is obviously fatigue, but irritability. Irritability is going to be the biggest one, just feeling so damn pissed off all the time. We're talking about you just don't even know, you just can't handle your loved one, you can't even handle your kids, you're just snapping, you're snapping at everyone, you hate your coworkers, you slam your computer shut, you're pissed off, you're kicking shit. So that's going to lead to, that's systemically from glucose. And I want to mention something here. It's not just one thing. It's not just one thing that's causing these issues. It's probably a few of these. Now, I want to talk about when you have this heightened sense of gluten, or I should say not gluten, but glucose. in your body cells, we're gonna have to turn that down. So when you have this heightened sense of all this going on, it's gonna lead to many problems downstream. I'm talking about where your heart's gonna be working harder than it should be. I'm talking about your pancreas is gonna be working harder than it should be tenfold. So that's just another big form. I don't want to blabber right now. So another big one is toxicity. Toxicity is huge. We're talking about toxins in our environment that are infecting our nervous system, infecting our immune system, infecting our neurotransmitter balance. Now, remember, if we're looking at like what is the root cause to many anxiety issues, we're talking about what is the root cause to anxiety. I want you to know it all can stem from us showing it through neurotransmitters. Neurotransmitters, catecholamines, norepinephrine, adrenaline. Okay, we're talking dopamine, acetylcholine. There's many neurotransmitters your brain has. Everything. I'm not a neurologist or brain surgeon. I'm not acting like I am, but I know physiology to the extent to where I understand that if someone's dealing with some type of anxiety type symptoms and issues, when you check neurotransmitters, most likely epinephrine, adrenaline, norepinephrine, which is actually paired with adrenaline, or higher for those individuals. I see it all the time in my coaching practice, in my company. So what you want to understand about this is that you want to get to that source. And toxicity, parasites, heavy metals, any infections like that is one of the main root causes. And then as most people fortunately are understanding now is any type of issue in your gut. We're talking about a gut dysbiosis. We're talking about SIBO, small intestinal bacterial overgrowth. We're talking about candida. These are just to name a few of what can be causing your anxiety. So if you watch this video in its entirety and you relate it to this, I do the testing to show you what the hell is going on inside your body. You know how you don't feel well, you're aching, you're in full of pain, you have anxiety, chronic fatigue, and then obviously you can't lose weight, you have stubborn midsection belly fat. I fix that all because we get to the true root cause. So if you watch this video and you're related to it or you want some help with fixing it, please tell me, what can I do to fix it, Diego? What should I be doing? You know, matter of fact, I'll tell you what to do to fix it today. All right, so how to fix your anxiety. Okay, we just talked about some things that cause anxiety issues. We're talking about the thyroid dysfunction. We're talking about the insulin resistance you're dealing with. We're talking about the total tox, or not the total tox burden, but the toxicity that your cells, your body, your nervous system, your neurotransmitters are under. Okay, the first thing is, yes, blah, blah, blah. You got to test and not guess. Yeah, but we don't have hundreds of dollars to test, Diego. Okay, so what are we going to do? Well, the first thing you got to do is start to regulate your sleep and circadian rhythm. What does this even mean? When you start to get sunlight at the beginning of the day, you're resetting your circadian rhythm. When you start to dim down your lights, start to block a lot of excess blue light between after the hours of 7 to 8 p.m. or before bed, you are going to start circadian rhythm wise. So that means you're starting to increase how your body's internal clock is restoring. That is going to have therapeutic effects. We're talking about restoring mitochondrial health and restoring all other physiological dysfunctions. Now, I want to talk about another thing. So that's going to start to correct your thyroid. That's going to start to correct your glucose and many other things. Now, the next thing we want to speak on is how to get this toxins out of your body, because that's going to be another big thing. So the best way to do it is anti-inflammatory diet, more Mediterranean type diet eating styles, because when in nature, the Mediterranean diet is very anti-inflammatory in nature. So that's going to really help with just reducing overall inflammation, reducing something called neuroinflammation, and really also balancing blood sugars and the appropriate amount of protein. So when you look at the macronutrient ratio of Mediterranean diet, I do think that you want to increase that protein because protein is sitting at around 20%. And so I want you to do it. And I'm, like, yet again, if you're watching this and you still are like, holy crap, this dude's talking really fast, my apologies. I think it just happens with a little bit of passion in there. So the next thing I'm seeing is that following an anti-inflammatory diet, eating higher protein in that diet, that's going to look like sweet potatoes. We're talking about bison. We're talking about ground beef. We're talking about chicken, pasture-raised, organic if you can. We're talking about sweet potatoes, white rice, any type, all fruits. I love fruits. We're talking about grapes, bananas, mangoes, oranges, just some of those to name a few. and then any type of whole grain, white rice, sweet potato, or anything like that. And then I love the fat. So we're talking about, it depends on if you're dealing with gut issues now. I personally eat a lot of seeds and nuts, but I do take a lot of care of my gut. Obviously, I talk about gut health. I talk about gut health side. That is, but then the third part of that too is that the gut microbiome, gut brain axis, that is influenced. So that's going to really be important as you are going through all these things and everything like that. But that's just going to be some few. Now, if we're looking for therapeutic tools, we're talking about magnesium glycinate. Some of these supplements like magnesium glycinate will be heavily beneficial for these specific issues that you are dealing with specifically. The next thing is going to be L-theanine and magnolia bark. We're talking about magnolia bark. If you don't know anything about that, those are great herbs to be used. But if you want more info on any of this, I can help you with this, guaranteed. So just reach out to me, comment anxiety maybe down below. I'd love to help you out.